Member for Courtenay-Alberni.
Madam Chair, my question to the Minister, has she heard of the expert task force on substance use?
The Honourable Minister.
Madam Chair, what I would say in response to that is I appreciate the member's advocacy with respect to opioid the crisis that we're facing, and I thank him for his work.
The Honourable Member
No.
for Courtenay-Alberni.
Sounds like a no. They're a group of experts who were convened by Health Canada to make recommendations to the government on federal drug policy. The expert task force had 5 key messages related to Canada's substance use strategy. One message was that bold actions are urgently needed, including the expansion of safer supply. I asked the Minister at the Committee of Government Operations and Estimates on April 29th what she will do to procure a safer supply of controlled substances to address the toxic drug crisis. Has she taken any steps since then on this issue, such as reaching out to the Minister of Health or the Minister of Mental Health and Addictions?
The Honourable Minister.
So, Madam Chair, what I would like to say again is I appreciate my colleague's advocacy on this and to assure him that our government recognizes the problematic substance use is a health issue. With respect to a procurement perspective, we are the PSPC procures, Health Canada is the client, and provinces deliver health to provinces and territories.
The Honourable Member.
Madam Speaker, to the Minister, have any of those ministers reached out to the Minister for procurement?
Minister.
Madam Chair, what I would say again, just to be clear, so it's provinces and territories that are responsible for the delivery of health care to provinces and territories. I, as the Procurement Minister, will procure based on requests that come from Health Canada, and we work with provinces and territories through the Health Minister to determine what...
For Courtenay-Alberni.
Okay, then here's a quote. It's from something you wrote, Madam Minister, in the PSPC 2022-2023 Department Plan. It says, quote, nearly 2 years into the COVID-19 pandemic, protecting the health and safety of Canadians remains a priority for the Government of Canada. PSPC will continue to play a central role in our response by procuring critical supplies, including vaccines, tests, and therapeutics. It's now been over 6 years since British Columbia declared a public health emergency. Is the health and safety of some Canadians, like people who use drugs, not a priority for the government? And why is PSPC not playing a central role in responding to this crisis?
The Honourable Member, Minister.
Again, Madam Chair, what I would say in response is that we respond to provinces and territories. We've been working very closely with provinces and territories. Provinces and territories have asked us for supplies. They've asked us for over 100 million vaccines. We've provided over 100 million vaccines. They've asked us for rapid tests. We've supplied over 600 million rapid tests. They've asked us for therapeutics. We've procured 1.7 million therapeutics. And we've distributed these products to the provinces and territories because they've asked for them. And I want to thank all those that have worked so hard to make that possible.
The Honourable Member.
Is the Minister saying she didn't procure any COVID response needs without direction completely from the provinces?
Honourable Minister.
What I'm saying, Madam Chair, is that we've been by the side of the provinces every step of the way because we know that they're delivering for Canadians. Through this, we've responded to their requests, and we have been very pleased and happy to be able to support them.
Well, they've been requesting leadership, Madam Speaker. The mandate letter for the Minister directs her to continue to procure COVID-19 therapeutics, tests and vaccines for adults and children to ensure all Canadians have access to free booster shots and second-generation vaccines as needed. Yet, there is no mention of procuring a safer supply to address Canada's other ongoing public health emergency and overdose epidemic. Do you believe stigma has played a role in this lack of direction from the Prime Minister?
The Minister. I would ask the Honourable Member to direct his questions directly through the Chair. The Honourable Minister.
Madam Chair, what I would say is that vaccines and therapeutics have been the only medications that we have bought on behalf of provinces and territories. They've asked us to procure those things, and we have been there. In fact, 8 out of $10 that have been spent by the federal government in supporting provinces and territories. With respect to investments that we've made, $800 million to set up community-led harm reduction, treatment, and prevention projects since 2015. Significant investments.
I remember Courtenay-Alberni.
Through you, Madam Chair. Her colleague, the Minister of Health and Mental Health and Addictions, told CBC that safe supply is going to be the way that we will save the most lives. Yet the minister is not committed to a timeline for expanding access to safe supply, saying research is needed before it can be scaled up. Why is the government wasting time on pilot programs instead of ensuring a safer supply is available across Canada?
The Honourable Minister.
Well, Madam Chair, I'd start by saying I'm really pleased that the Prime Minister has appointed a minister for mental health and addictions, and I am very confident that that minister, who is a doctor and who is very passionate about this area, is going to deliver for Canadians, and she has. And with respect to safe consumption sites, we have made investments. This has saved supervised consumption sites have reversed 35,000 overdoses since 2017 without
a member for Courtenay-Alberni.
Madam Speaker, 20 people a day are dying in this country because of a toxic overdose. 20 families are getting the call. If this government had the political will, how quickly could a safe supply program be established in this country?
The Honourable Minister.
Again, Madam Chair, I appreciate the member's advocacy, but I would like to point out that we are making significant investments in this area, and we will continue to do so.
The Honourable Member.
Madam Speaker, many Canadians that want access to safe first supply can't get it. So that falls short, that answer. Does the minister have any idea of the cost of substance use issues in Canada, factoring in health, social services, policing, justice system, lost productivity, and other relevant costs?
The Honourable Minister.
Madam Chair, I'm happy that the member has actually raised those issues, because we are working to divert people away who use drugs away from the criminal justice system towards supported and trusted relationships with health and social services. This is an extremely important measure. This is one of the many measures that we are taking, and we're going to continue to work in this regard because we...
For Courtenay-Alberni.
Well, Madam Speaker, I live in Port Alberni. You can't get even access to detox. It's 3.5 hours for a youth to go to Victoria, and there's a waiting list often. Madam Speaker, in the second report, the expert task force said current policies are currently costing Canada huge amounts. It recommended significant new investments to reshape the system and address the drug toxicity crisis. Since then, the government has committed $100 million over 3 years. Does the minister believe that represents a significant new investment that responds to the scale and emergency of this crisis?
The Honourable Minister.
So, Madam Chair, what I would recognize is absolutely this is a crisis. There's no question. But our government has been there to support. He mentioned the $100 million, but in fact, the total now is $800 million to support community-led harm reduction, treatment, and prevention projects since 2015. And I know the minister is working very hard on this, and I look forward to the work that she will be announcing as we move forward.
Our member.
Madam Speaker, the stigma is not just in the policy. It's in the amount of money that's been spent on COVID-19 and on the toxic drug supply crisis. When will this government respond to the toxic drug crisis with the urgency it responded to, like COVID-19, in a way that shows that it values the lives of people who use drugs, the people that are dying right now in our country, the lives that could be prevented from preventable deaths?
Our Minister.
So, Madam Chair, what I would say is we realize the hurt and the difficulty. And I worked in a high school for 20 years, and I can recognize how opioids can be a problem, drugs can be a problem, but our government has taken action, and we're going to continue to take action. And I am delighted that we have a minister appointed specifically for mental health and addictions. Extremely important.
Honourable Member.
Madam Speaker, the government says they're taking action. More people are dying. The deaths are mounting. They're not taking action in a way that needs to be taken like they did with COVID-19.